Hey everybody, welcome to our 7-minute health chat. Robin and I are really excited to speak with our special guest today, Dr. Bartlett, as in Bartlett pear, one of my favorites. And
Yes.
so Robin's gonna go ahead and introduce her right now.
All right, great. Thanks, Kim. All right, so Dr. B, as she likes to be called, Heather Bartlett, she has a practice here in Columbus, Ohio called Metabolab. And I met her, well, I really didn't meet her. I'm meeting her for the first time today, but I watched a replay of a Zoom meeting that we had with a company that I work for, Wellness Collective. We've had Katie on the 7-minute health chat before, and I watched this replay and I was just blown away by the information. And I immediately said to Kim, we have to get her on the 7-minute health chat because we have to get all this information that she has out to everybody. So she was so gracious. I know she's a busy lady, to come in here for our 7-minute health chat and let you guys hear all about what she can do for your cellular health to help with anti-aging. So take it away, Dr. B.
Oh, thank you for that intro. That was very kind, very kind. I just like sharing the good word is the best way I can put it. I'm very pro data for people, for patients. And so just a moment ago, I just said that to you, but I think that the entire clinic purpose is to empower individuals to know more about their body so they can make an impact. So today we had talked about that we were going to go ahead and do a little discussion about actually cellular health and how it relates to anti-aging and longevity. So let me figure out how to screen share here. I'm usually technologically okay, but here we go. Give me 1 second here.
I love this because I love to see things. This is okay, awesome.
All right, let's see if we got this going here.
Yep, it's something popped up there. It says it's
There we
loading
go.
now. There we go. Awesome.
Here we go. Off to the races. So understanding cellular health for anti-aging and longevity. So there's a couple of things that I think that when we think about as we mature, that we don't take into consideration, because most people just think of, I want to be able to do the things I want to do. And what we just experienced recently with the pandemic is that it's not just about doing what we want to do. It's actually about our immune health, right? I think that sometimes falls by the wayside as far as what does great aging look like, maturing into these years that we've really looked forward to, not all of a sudden pulling the plug and being like, now what? And I'm not feeling well and I don't want to do things and I'm feeling low energy and maybe I feel depressed and what happened to my body? So it is one of those things of we need to look at a cellular perspective. Part of that is about our immune system. And it's a critical thing between understanding antibody mediated stuff versus our actual, our body, what we were born with. Okay. And being able to know actually the capabilities of that. That's actually what kind of threw up the red flag for us with the pandemic and with a certain virus, because our own immune system was turning on us. And so knowing what that level of immune function is a critical thing. The other thing is, a lot of people kind of scratch their head and say, I don't understand why some people didn't get as severe or some people did get severe. And knowing somebody's actual immune status function, that innate immunity is a big deal. So that is, I'm just throwing that out there real quick because that is something that I check in this clinic for people, which is not a common thing. So another thing, talking about energy, right? Well, it's not just energy for us to go and do the things we want to do. It's about actually making sure that our body is capable and being able to keep the cells healthy. It takes a tremendous amount of energy for our body to be able to do that. I mean, if we know anybody that's ever been in the hospital, of course, personal experience taking care of people, of course, but the amount of energy required for healing is a really phenomenal thing. So let alone going through chronic day-to-day stresses or anything else, plus any other stressors that are put on somebody, it requires a lot of energy. And some people are really, as my wife likes to say, they're giving from an empty cup. There's not really excess to help somebody actually do healing. And then we've got some other depletion things that just happen as natural phenomenon. Let's just say somebody is really doing the best thing that they can do for their body from a longevity perspective. We still have things that we're battling that are just going to be age-related decline. And unless you're really taking a proactive and doing some basically some newer, kind of precision medicine things, you really can't do much to impact it. And one of those things, of course, is knowing about your mitochondria. And I'm sure you guys have talked about this a lot, but like it is a very overlooked little organelle. So I've got a little picture later, but we have a natural age decline of mitochondria. Mitochondria are the batteries of our cells. Sounds neat, not a big deal. It's critical, absolutely critical. And especially for people that are trying to do fatty acid oxidation or beta oxidation, also known as fat loss, fat burning, that happens in the mitochondria. So people who don't care about cellular health and don't care about the organelle as part of those cells, that is the mitochondria, they're really missing the big picture here of how they can change whatever their goals may be. So now take the mitochondria, add somebody that has some type of metabolic derangement, known or unknown, and it throws gas on the fire as far as the level of depletion of mitochondria as well as the speed. A lot of people don't know that. So this was something in my practice that was really in my old direct primary care practice that my eyes got open to, because once I got to know my patients really well, it didn't make sense that some people, they were following my advice, traditional medical care, they were trying to exercise, and here's a tell. People who go and they're exercising and they're really slamming it at the gym, and maybe you've looked at somebody next to you on the treadmill or you name it, and they're like, look at you like you're crazy, because they're like, why do you feel like you feel good after you exercise? I feel terrible. Like I feel worse than when I started. And I had patients that after I had read the Mayo study about, is there such a thing as anti-aging exercise? Because by definition, we lose mitochondria as we mature. If you can drive the number of mitochondria up, well, technically that's anti-aging. So when the Mayo Clinic published that, I think it was, it's been a while, 2017, 18 maybe. I thought, that's it. That's all my patients have to do. And I sent some patients to do it. And sure enough, they came back feeling worse. So this is this phenomenon that unfortunately some personal trainers they're working their heart out with clients, and neither are feeling like they're having success, but they can't understand the why. There's something cellular going on. This is an energy problem at a bigger level. Now, NAD, nicotinamide adenine dinucleotide. It is we're going to talk about that as well. It is a age depleting thing as well that is absolutely critical at the mitochondrial level, again, for energy. Just quick overview on this page here. And then when we talk about antioxidants, what, people who tend to be very health centric, they tend to be very proactive with antioxidants, not knowing that actually too much of a good thing is too much of a good thing, and they can actually become pro-oxidants. So that's something else that I check for patients. That's kind of a big deal, right? Because you think there's no such thing, and in fact, with the excess, what can happen, even with other micronutrients, is that other viruses and bacterial agents can actually basically overpower and utilize those for their own weaponry. So too much of a good thing is too much of a good thing sometimes. What you don't measure, you don't know. And I do believe that that's a true thing.
Can I ask a question real quick, Dr. B?
Yeah, absolutely.
So how do you know when you're having too many antioxidants? Because like I focus on an antioxidant diet myself.
Absolutely.
Okay. So how do you know?
Yeah. So we'll talk about that. So actually, it's been years. I've gotten solicited by so many different lab companies hawking their latest thing. And I have decided that the company that I think does the best lab work is actually SpectraCell. And they are a lab company that I'm from Texas, for better or for worse at this moment, the day after elections and everything, but
we're apolitical here.
Yeah, okay. Anyways, but I am from Texas, and actually I'm an Aggie, a Texas A&M Aggie, and two really profound pieces of the science that laboratory created one was actually at the University of Texas Austin, and the other part was actually at Texas A&M University. And they really pride themselves for 30 years of being a lab company that took academia out of academia, the testing that was only allowed in research labs, and getting it into the hands of consumers and physicians. And so they actually have a measure of knowing what somebody's antioxidant load is, intracellularly. And the fascinating thing, we might as well talk about this because we're here. Fascinating thing about their testing is it is actually looking at white blood cells, T lymphocytes, and you have to get the lab specimen very quickly. And they have this media that they grow these cells in, that is considered the extreme perfection for cell replication and health. like perfection. And some mediums don't do that, and they will have excess protein or excess serum in there that will actually muddy the results. So this is a patented thing that they actually do this in, number one.
Okay.
So first of all, you have to have your burden of knowing what is good testing. And without knowing that, what does anything mean? It's the same thing as when you're looking at body composition testing, whether it's with an N-body versus a bod pod versus a DEXA. They're all inaccurate if somebody is full of poop and did not prepare appropriately. But nobody talks
Right.
about that. I mean, I'm
Right.
sorry, but that's true. But people
It's
don't.
just funny the way you said it. That's funny.
Yeah.
Yeah. So, well, it's truthful. So it's all about really preparation and understanding what the labs are able to provide. Are they quality? What are they, and what are they telling you? You know, it's one thing to be like, well, you got too many of these things. Being able, and what they are world class on, is being able to look at the functionality of other things as well. So glucose, insulin, actual function of the cell, fructose metabolism, actual function of the cells. Excuse me, being able to look at the antioxidant load, so to speak, perfection or burden, depending on where you're at. Same thing with immunity, being able to look at a number of things, being able to actually quantify according to, in comparison to age groups of similar people, where are you falling on this spectrum? But so what? What good is anything if you can't do something about it? And I tip my hat to much of functional medicine, but I think there's a space and a place where we have to look at also understanding bioavailability of what we're taking.
Yep.
So if we're supplementing a lot, but we are not getting it in, that is a different discussion. And it's been a very eye-opening thing for a lot of my clients, of just being like, oh, I just take this multivitamin, or I just do this, or I've taken this whole sheet of things, and I can't actually tell you if it's making a difference or not. And this is the whole nature of the cellular, is we can look at stuff that's serum, and I'm very passionate about the stuff that's serum, but what is actually going on at the cellular level is determining what's happening everything else. So my approach is cell up rather than disease down. Disease down, I did it for many years. And the thing is, it didn't really seem to solve things for people. Solve, maintain. And the big question that nobody in medicine has really been trained to ask is, does anybody ever feel better? I think it's a simple question, but we're not trained. I can tell you this in my medical, to ask if people are feeling better. We ask if somebody's blood sugar number is better. We don't ask them if they feel better. Maybe we get lucky and they say they have more energy, but that is not a topic of discussion, because on some level, we're still intercepting things at a one enzyme at a time level with a basic allopathic medicine. And I'm not pooping on it, but it is a different thing if you're trying to go and figure out, how do you help somebody feel better? And I think we can get really in love with the idea of this root cause of what's causing something terrible for somebody, without saying, wait a minute, how do we just get you feeling better? Because from the level of the cell, like the cell approach, all these cells make the organs, make the organ systems, make our body. So if we're not actually talking to the cells, about the cells, trying to enable the cells, support the cells, amplify the cells in a good way, then what are we doing? We're not creating any good change from the cellular level. And so we're just continuing duplication of sick cells. That's not an answer. So does that all make sense?
Yes.
Yeah, that's
Okay.
a lot of good information.
Oh.
Yeah.
Okay. I'm going to try to go through this faster. Sorry about that.
No, you're
This is
fine. Go ahead.
Okay, this is a relevant thing. If you've ever heard, have you guys heard of cellular senescence? Yes.
I have. Yep, I have.
Okay. So cellular senescence is an abnormal thing where cells that should be it's marked for apoptosis and just dying, okay, in a natural pattern, they don't die. They stop dividing, but they just hang out. And the problem is, their hanging out causes all kinds of abnormal signals as a result of that, okay? So they trigger a tremendous amount of inflammation as well. And as you can see here, various types of stress, such as telomere shortening and more, can contribute to this. So we're going to talk about telomeres a little bit later. Don't worry. So hold on to that hat there. But this is the crux of understanding why cellular health matters as far as anti-aging and longevity. So is cellular senescence the same thing as aging? No, it's not. You have natural aging mechanisms, and then you've got abnormal things. You've got autonomous things, and then you've got the non-autonomous, which is part of these zombie cells, okay? So again, one of those things people say, so what am I going to do it? Why am I, there's testing just to test is not the bandwidth that I care about. Testing to be able to implement change is how I got to the place of even reverse engineering this clinic concept. So it's not all Debbie Downer. And a lot of people, when they hear this stuff, they're like, well, there's nothing I can do about it. So why do I care? Why should I test it? So we'll get there. Oh, why isn't my, oh, there we go. Sorry about that. Senolytics. Now there's actual FDA stuff that's out there. Quercetin is not. Clearly you can supplement quercetin, but that are senolytics. So these things that are going and they're clearing up these senescent cells. Who wants these things? If you read some of the studies outside of quercetin, these are like A-bomb kind of agents. I don't necessarily know that I want these things. So let's think of this from a more holistic perspective of what can we do. So at an easy level, exercise. Okay, and we're going to talk about the exercise component a little bit later. Exercise alone, is that good enough? In my opinion, I don't think so. Because after doing genetic tests with patients and really finding out how people's bodies respond to exercise in different ways, under different stress, under different goals, one size exercise does not fit all for all people. Same thing. I really want to work with personal trainers who are interested in learning genetic insights if patients are willing to share that with them so that they can really custom tailor what they really need to be doing for their goals and how their body responds, whether it's not just weightlifting, not just cardio in certain amounts, and how does it respond to fat loss? How does it impact their VO2? All of these things. So, but exercise is something that can help with these senescent cells, these zombie cells. Fasting, intermittent fasting is a powerful thing as well. Okay, we know about that. Well, is intermittent fasting good for everybody? It's pretty darn good for most people, actually. And if somebody could do a 24-hour fast twice a week, not even a three-day altogether thing, they would get a tremendous benefit of cleaning up these senescent cells with that too, based on the literature. So at the end of the day, when we're talking about these senescent cells and trying to get all these signals and healthy and these cells that were not senescent cells to actually do what they're supposed to do and follow the goodbye signal, it's all about making sure your cells are healthy and trying to, if you can, intercede in the next cell division, trying to help improve that. So, and that takes energy, which we talked about. How are we doing? Did it okay?
Yep. Yeah. And
Okay.
I'm excited. I had telomeres written down because I wanted to ask you, talk about that.
Sure.
And I totally agree with intermittent fasting. It's what I help my clients with because it helps with autophagy to clean out those cells a bit, get rid of those cells. So I think this is great.
Absolutely. So I borrowed this from SpectraCell's education, actually. And so when I was talking about the immune thing, I think people really do have a hard time. They've heard so much about immune system function regarding what has just happened in the last 2.5 years that we've kind of forgotten what does that actually mean. And so when we're looking at this, I'm talking about the things that can cause inflammation and can cause those cytokine storms. It is that innate immunity. So we want to know and test that, because as well, if somebody's been under those chronic stresses like we were talking about, they can have a poor response, right? When people are like, I don't understand, you're diabetic, hypertensive, and you didn't feel anything from the vaccine or the booster, or you got COVID, and it's like, no. And everybody's kind of like, what? And meanwhile, other people who have the same kind of litany of things, they had it really severe. What's going on there? There's something going on at the immune level. Okay. So functioning that is testing the actual function of your immune system is a totally different animal, and knowing how you can actually help that. So I like, let's see, this is a quick little quiet video, but when we're talking about the mitochondria and we're talking about energy, I jokingly say my clinic is the energy clinic, because it all starts with energy, not just us being able to move, but at the cellular level and making sure things can heal. And so this is a quick imagery from the genome.gov website of like mitochondria. We forget. We go into these tiny cells, we go into the cells and we look at the compartments of it. We see these organelles. These are the mitochondria. And this is literally where the fat burning happens at that dual membrane level. So just as a quick kind of replay. So NAD, let's jump just for a second because we're going to talk about energy some more. So NAD is super important at the mitochondrial level. This is something that is diminished over time with natural aging, but again, can be accelerated for some people. Don't know the mechanism exactly on that, but it's probably pretty similar just to overall mitochondria. Now, the thing is that as we we have the most NAD possible at when we're born. By the time we are 40 or 50, it is about cut in half. And then you can accelerate that past age 40 or 50 each decade of life. Now, the relevance is NAD is an absolute necessary cofactor to what goes on in the mitochondria. I've got a picture to show you in a second. But the main way that NAD is preserved in the body is through something called the salvage pathway. And the salvage pathway is the recycling, just like autophagy, so to speak. It goes through and goes through. But at some point, it's kind of like a battery, a nickel cadmium battery. It just stops. It's got a half-life. It's done. So unless you're actually doing something to increase the levels of it, it is not coming back. Now, this is a profound thing for my patients. Profound. When they start supplementing with this, if they decide to, because it is night and day, and they can't make it up. And sometimes they go off of it, and then they're like, "Whoa, this is what I used to feel like, and I had no idea that my baseline was that poor." So NAD is a big deal. So here we go. You can see the little red on this picture. You can see every place that the NAD is cycling between NADP and NADPH. It's an electron donor and receptor over and over again that allows these things to keep replicating. So you can understand if your NAD levels are low, this is a big deal. It impacts everything, even just from simple glucose utilization, let alone, again, fatty acid oxidation or beta oxidation or fat burning. And I want to say this to people because I don't know that this is actually directly said to a lot of people. When, as a family medicine doctor, the probably most cruel thing that a doctor can say to a patient is you need to lose weight. What you've just asked them to do without giving them any advice or any data on how to is do the hardest biochemical reaction in the body that the body does not want to do. So when you're looking at this picture of these mitochondria and all that, if that resonates at all, it is a useful thing to know your data and to figure out how you can biohack your body. I know it sounds cheesy, but genuinely, because it is a hard thing to ask your body to do. It's already hard enough societally and everything else. But from a biochemical perspective, it is an unfair thing without somebody really knowing the best ways that they can to ask them to do that. That's my personal take. So that is a great image that's actually from looking at basically the impact of mitochondria in the heart in diabetic individuals and how not uncommonly they progress to heart failure. And this is a big deal regarding that, is that mitochondrial health and the role of the acetylcholine being able to make that happen. So what is NAD? So now we talked about it. See, I don't think it's fun. I like doing the reverse. I'd rather say something important and then say what it is, because otherwise it's like, okay. So NAD is the chemical cousin of vitamin B3, niacin, okay? In the 1930s, it was used turning off the cravings of addiction, predominantly alcohol and opiates, and schizophrenia treatment. It wasn't patentable because it's a natural occurring thing in our body. So guess who doesn't care about it as much?
Big pharma.
There you go. In 1990s, it kind of resurfaced, okay, in Mexico with addiction and addiction space. And then a gentleman in 2005 had an executive who went there, got treated, changed his life, and was like, that's it. This has to come back. Well, he had to get the actual rights from this compounding of NAD, which was only in South Africa at that time. So he bought the rights and he brought it back. So Dr. Craig Conover, I don't know if y'all have ever heard of him, but he has been in this space for 15 to 20 years out in South Carolina. Well before IV infusions were I keep looking this way because your picture over here, I should move your picture up here. Well before IV infusion clinics or any of this stuff was mainstream at all. And he got interested in NAD accidentally because he was actually doing a lot of chelation therapy and seeing really phenomenal results with that. Well, this gentleman that had been treated approached him and said, I need your help because doctors need to know how to do this. We need to figure out protocols, like they need guidance because more doctors need to do this. So Dr. Conover actually did this. So not long ago, I had already been creating protocols with NAD injections. I decided I wanted to go hear from the man with his input about the infusions, and so I did. So he is a fascinating physician, very passionate. And he figured out if you talk to a lot of people with NAD infusions, if you do any Googling or anything like that, they are very long infusions, because it is a very, you're pumping into your body a massive amount of cofactor energy that can feel, you feel it. It's not like getting a B12 shot. You feel this. You can feel uncomfortable. You do a high dose too fast, you don't know what you're doing. It doesn't feel great while you're doing it. When you're done, that's a different story. I don't know how else to say that. That is a different thing.
Yeah.
But he figured out how to make this tolerable at appropriate doses, higher and faster, within about an hour and a half to 2 hours maximum. So that's a big deal, because most people don't have time to sit around that long. Okay. So I find that there are two ways. I'm not going to use the saying. There's two ways to do things. I have cats, so I can't use that saying. There is a space for injectable NAD, and there is a space for infusion as well. But the bigger thing to me about those things is you need to understand there's a lot of NAD precursors that are sold. Now, Dr. Rhonda, gosh, I can't remember her last name. Anyway, she's a phenomenal PhD who goes back and does a lot of retrospective research looking at all the studies. And she did a great thing on the precursors, the oral precursors, and they do not bioconvert well into NAD, unfortunately. And nobody talks about this, but if you can, I should have put a link in there for her retrospective review on that, but it is powerful. So you can take these things, but if you're not actually, again, bioavailability, your body's got to convert these things, and everybody's got different enzymatic processes and levels. It doesn't mean that you're going to get it. So I just don't want anybody who's ever tried some NAD precursors to be like, this is a hoax, this isn't a thing, because I've never felt any benefit from it. It's quite possible that you may not have felt benefit from it. So that was a little bit of background of just understanding the energy stuff. And I'm sorry, there's a fire truck going by right now. This whole clinic got to the place because I couldn't blame my patients. Okay. I couldn't say medical noncompliance is the reason why people were not having the outcomes that I was trained should happen with traditional allopathic medicine, whether it's diabetes, cholesterol, high blood pressure, you name it. And where I kind of got a little bit nerdy about this stuff was I got super into the cardiometabolic labs. And when patients were not responding, looking at that advanced cholesterol panel, particle size and particle number, something wasn't clicking right. And some people were on statins, some people were not on statins, some people got transitioned onto statins while that, and it still just wasn't making an impact. And that's actually how I got to the place of looking at this. It was like, wait a minute, remind me again, let's talk about the cholesterol pathway. How is cholesterol made? Where is it made? Where's most of it come from? Both from the liver, not from what we eat. That's right, that's right. So 70 to 85% of what is floating around in us is in a direct response to the liver. Well, why is the liver doing that, right? What is signaling to the liver that it would make these small particles of abnormal quantities compared to somebody else? But also, how many people are out there that are looking at a basic lipid panel and they have out there, it's an absolutely delusional perspective of what their actual cholesterol status is. There's people that have high total LDL and total cholesterol. And then if you go down and you look at their actual particle size and particle number, they light up green, they're perfect, okay? And then there's other people that look like they're totally normal on a basic lipid panel. And here we go, they light up totally red, totally abnormal levels of small LDL and medium LDL particles, which is a plaque makers. So this is actually how I got here, was not just make people feel better. This is a very strange thing. That happened to be a nice side effect that I figured out over time. But it was what's happening. And it was all, basic biochemistry. This is stuff that we learned in pre-med. These are the same reactions that we had to memorize and write down and figure out the carbons and the bonds and how much energy it took to break and make and all of these things. And in medical school, and it's almost like on some level, the next class we took was our pharmaceutical class, right? And then all of a sudden we stopped thinking about biochemistry. The unsexy thing about this, though, is that cellular health is not a pop a pill, so to speak, and you're set, which is what we're kind of trained, unfortunately, a lot of society in America, that's the expectation and that's what you should do. If you do that, you're a good patient. I'm not saying don't take your medication by any means, so let's just clarify that. But it is one of those things of it takes an intentionality. And when Robin and I had spoke last week, it is the default in America is disease. That's the default. And it's not people that are just eating McDonald's every day and people that we can look at and shun and judge and do all this stuff. That's not what's happening here. People do not understand how their body works. They don't know how they're accidentally sabotaging it. And it's just because this is not data or studies that has been intimately woven into what we should be looking for each person. We are a huge melting pot in America, huge. Our genetics are so different than even when we try to look at giant meta-analysis looking at European continents. There's so much more similarities in the genes there in certain places where they're doing these retrospective studies that it's not fair to the American public when we've got so much genetic diversity. You have to know what you're made of. And I do feel pretty strongly that people, you'll use genetics, unfortunately, if we get a malignancy, that's the norm, especially at a large research hospital nearby. And I agree with that. I think that's the right thing to do. Or you can use your genetics to your advantage before that happens. You can give it a good running shot. But the idea that some people are like, I'm just going to ignore it and not know anything about me, I think is that day has passed. It's almost, I caution myself to say irresponsible, but we have a personal obligation to our health. It takes intentionality for great aging, for longevity, and it's, it takes intentionality. So you can use your data to your advantage, making your lifestyle changes you want to. Or you can just say, I don't know, just happened. It happened to my parents. Well, I'm good right now. And then you get to their age and you look back and you go, I don't know how this happened. I didn't have this when I was in my 30s and 40s and 50s because the process was happening. And the last thing I'll say real quick about the cardiometabolic labs, by the time those labs flip, something bad has been happening for years. Okay. So there's lots of people right now who may have certain hallmarks of metabolic derangement, and yet they see their doctor, and right now their labs on the basic lipid panel look good. And so they get a pat on the back and they say, you're fine. I know, whatever. But that time will catch up, and it's just biochemistry. And that's the thing. It's not about somebody being a good person, a bad person, anything about that. It's just biochemistry. We just don't know when those cards will flip for people. So yeah, I was just going to say, so part of the things of why I'm talking about like the genetic testing, why I care about this, people need to know how their body actually responds to different macros. They need to know if their percentages are different. Do they burn fat? Some people have a mutation called a PPAR mutation along with other ones. That was actually a patient of mine that I can think of that helped me think about this clinic, was that I could not give him the answers that I was like, I'm reading about this and it's not making sense what's happening with your cholesterol panel and your effort and everything else. But there's this random mutation that maybe can get overridden with extreme exercise, but you got to hit this threshold. So if you don't know these things, you can literally be sabotaging yourself accidentally. And this, again, forget what you look like or anything else like that. This is about cellular health, because all this stuff happens over a series of reactions that are very complex and very calculated. And if you don't know these things, you can't, we're adding stress to the cells that is going to accumulate as we are in our longevity years that we want. So exercise, same thing. How does somebody actually respond to exercise? Different types of exercise. For what purpose? Like I mentioned earlier, is it for weight loss? Is it for increasing their VO2? Is it for actual strength ability? We can look at these things, and we have these metabolic indicators that give us an idea of this is what's happening. This is different than tendencies of micronutrient deficiencies. Forget the tendency thing, because now we can actually check the intracellular level of these things. That's a big deal. So talked about that. Yes. And then here we go. Telomeres, Kim, here we go. So telomeres are the tips, okay, of our chromosomes. And those things wear and tear just like the little plastic things on our shoelaces, okay? And some of it is natural, and then sometimes we can throw gas in the fire and we can make these things shorter. And when these things are shorter, we're getting more abnormalities that happen with it. So it will shorten over time no matter what. The question is, how fast will these things shorten? And as it says here, so lifestyle choices, sure, along with gender, age, family history, it all reflects in the telomeres, and the longer the better. So that's nice if we can check those things, and it turns out we can. So we can actually look at the difference between your actual biological age versus your chronological age. And that is an important thing, because there's people that say, oh, I'm only X age, I shouldn't care about this right now, but they could definitely have a biologic age that is far older than their chronological age, meaning the number of years old they are at this present time. So again, Devin, is this doom and gloom kind of stuff? No, because you can. I mean, this is the nice thing about our body. It's a brilliant machinery God made, that it can repair itself if you can give it the right things, and if you can give it a chance to heal and give it the energy it needs. So is it one thing like you check out and it's short and you're like, this is a terrible situation? No, you do something about it, and then you recheck it in about a year. So you can actually see, are you making an impact or are you not? Because they actually can at least pause, and for some people even lengthen slightly with those interventions. So there's a little picture just so you could see that easier for you with the telomeres, a little end cap there. And so hopefully this gives you a little bit more of a perspective of the cellular health and why it matters for the anti-aging. Thank you.
Thank you. I love this
Yay.
because this gives this all the science behind, you know, our cellular health, and just, you know, what we see things on the outside, we feel things on the inside. We don't always know why, you know, what's going on. But I love that you really gave us a deep dive into the background, so to speak, or behind the scenes, you know.
Yeah.
And I think that's important. And Robin and I geek out on this stuff, and maybe not everybody does, and you don't have to, but I think it's cool that you said there's science behind it. It's biochemistry. Your body doesn't lie, you know.
No.
And thank you for talking about the telomeres, because I've been reading about that too and understanding it. The other thing I think is cool is epigenetics, is like, we don't have to express those genes. You know,
Right.
it's really you know, your genes load the gun, but your lifestyle pulls the trigger on what genes get expressed and stuff. So I love that you said that. And, you know, and I love what you said about having to taking a personal obligation and being intentional about your own health. And you're right, you got to measure things. You don't know unless you measure. And I think that was really, really, really good. And it really,
I don't want people to feel hopeless. I mean, more than anything, I think that's the thing, is this is not, this entire situation is not a hopeless thing, but we're kind of been sold that we're whatever our health status is, we're just going to intercept and maintain the disease process, not necessarily reverse it, right? And so I just want people to feel hopeful that you have autonomy over your health through it's lifestyle, all those things matter, but you kind of do need to know that data too, of how your body's processing stuff, because there's a lot of people who are absolutely trying to be very health centric, from all and I absolutely agree with you guys about whole foods, but some people, they cannot metabolize fructose well, or while they're trying to do things, it's absolutely a gas on the fire for something called leptin resistance, which also has been shown to downregulate mitochondria. Again, more fatigue, more willingness for people that don't want to, that literally physically feel incapable of exercise, because they probably are mitochondrially incapable. But that doesn't mean you get a free pass.
Yeah,
you don't do
that's
something.
what I was just going to say. Right.
Yeah, no, and if anything, it should be more empowering. I'm sorry, Kim. I just wanted to add.
Yeah, no, I love it. It's please, because I think, you know, everything you've said, you know, and you know the statistic I know about, like only 12% of the American population are metabolically healthy, which is bizarre to me. That means that 88% of us are not or in some sort of metabolic distress, you know, which is crazy. And I blame, obviously, lifestyles, our current food system is working, it just creates a disaster for us, you know, and with the fast food, with the processed foods, with the sugar, you know, all the stuff, the fake
Absolutely
stuff. But anyway, but yeah, I like this that you get, there is hope, you know.
Absolutely.
We don't have to, and I would say this too, we can choose to age old or we can choose to age young.
Yes. Absolutely.
And it's like, what are you choosing, and what are you doing to do that? You know.
Exactly. So if people do want to find out more about their cellular health and take that deeper dive here in Columbus, Ohio, tell us where they can find you for more information.
Sure. My website is the easiest. So that's Metabolab. So metabolab.clinic. So www.metabolab.clinic is my website. I'm actually in Clintonville, so smack dab in the center of the loop. So pretty easy to get from anywhere, whether it's New Albany, Dublin, Pickerington, you name it. It's all smack in the middle. And I'm on North High Street too. So easy enough. 3630 North High Street. Yeah, I mean, lots of
And
information on the website.
and they can set up an appointment with you, like
Yeah,
do a
so
consultation and
listening to recent patient feedback, what I've decided, I kind of glossed over very quickly kind of the offerings, and really each person has their own story, has their own goals, has their own needs, has their own budget, right? And so what I've decided is that really what needs to happen is I do a 30-minute complimentary consult where basically I'm explaining the clinic and the offerings. Cost them nothing because it's a lot to understand. I know that. But it's also a useful thing. And if somebody decides like, actually, yeah, this is resonating with me. I actually want to have my medical history like reviewed with you, then that's a different discussion. And that is a paid consult because we're probably going to go over an hour easily talking about that. And they're going to fill out a very extensive lifestyle and food, nutrition, exercise, everything questionnaire that they've probably never seen like before. And I'm going to look at that before we talk for the purpose of it needs to be a productive conversation for that individual. I need to know if I can help that person, right? If somebody is not going to do anything participatory, but they just want testing done, I'm probably going to say, might want to save your money until you're motivated in a very kind way. I don't want to take your money until you're ready. I don't want this to be another failure for somebody.
Right.
That's supposed to be the opposite of what this is. This is you get your roadmap for your body and we figure it out. And then past that, we figure out how can we try to really get this going faster for you if that's something you're interested in. So that's the methodology of learning about the clinic and kind of onboarding, so to speak. But that second conversation is a heavy hitting conversation because we really, we have to, what people don't know that they don't know about themselves as well is very illuminating, right? If somebody can't tell me their caloric intake over the last 2 years, high, low, average, otherwise, well, that's very telling. That's not a judgmental thing, but there's an awareness that will need to change in the future for that person if we're going to have success. And so it is probably going to be a different conversation. That's what I hear from most patients, which is nobody's even ever inquired about this before. But it also gives us a roadmap of we have, not zero of this is the starting point, and we can track and see how things are changing for somebody with sleep, energy, mood, cognitive ability, all of these things. We can actually look at these things and not just be like, how you feel? You feel good today? Okay, good. No, I want somebody aware and paying attention, because when patients get a new baseline, when they feel better, that is a crazy thing for them on some level that sometimes they forget how bad it was. And if we don't have that stuff kind of logged,
Dr. B, you do televisits too, or
yeah, I do that. I actually do both those first two on Zoom. And the reason why is
nice.
I am screen sharing information with them about the clinic, A, and then B, we're looking at what they told me about themselves, right?
Good.
And that is also an important thing going forward, even with whatever protocol we decide is the best thing for them. That here we are again, we've got our data. We can't look backwards and say this didn't work because, well, what are we doing?
Right.
We have to be accountable. We have to know, not an accountability like you're terrible, but like you have to know what's working, what's not, what we're actually participating, what we're doing, that intentionality.
Wow.
So
well, thank you. Thank you so much.
So quick question though, what results have you seen since you started doing this? Like what turnarounds have people had?
Sure. It's interesting because ladies who are around my age that it was not really said to me. I met the spouse later, but I need to lose weight. I don't like how I look. I don't feel good. I'm not sleeping well. Okay, this is what this individual says.
Right.
Spouse later, about 6 to 8 months later, says, "Oh, spouse couldn't go up and down the stairs because knees hurt so bad, so inflamed, so achy." That was not a big conversation part at all. But apparently in that relationship, it had been discussed a lot that was like a tipping point in these other things. So all those things I'm talking about, all of that coming down, inflammation, better sleep, learning about how alcohol does impact people, right? But really owning it. how genomic, precision genomic supplements that are high bioavailability, how that impacts. Learning how vitamin B12 is absolutely a necessity at the mitochondrial level, that all we talk about is neurodegeneration and red blood cell health, when it is absolutely critical, looking at the folic acid cycle and the B12 cycle, that little double swirl. And most people are not getting it, not because they're bad people. And yes, some vegetarians and yes, some vegans are absolutely at more risk, but there's a lot of people that it doesn't matter. They can be eating a steak every night, but they've got some inflammation in their bowel. They're not absorbing it. Or once we get around our 5th decade of life, our intrinsic factor drops. So you start supplementing that. I have I use 2 different types of B12. One is longer binding to the plasma, and the other is the methylated form. So people who have that MTHFR mutation, they immediately get the benefit, and it doesn't have to do that change over that actual enzymatic process that they can't do genetically. People who fatigue, right? They said these other things, but then on the other side, it actually became a story about fatigue. Yes, these other things changed, but the biggest hallmark to them was, God, I had no idea I was so tired. I'd been doing the same thing for 2 to 3 years at the gym and with a personal trainer, and nothing was getting better. And I finally saw you because actually my clothes were having to get bigger, but it's not because of the biceps. Right. And these things happen, and it's nobody's fault, but you gotta have the roadmap for that. Right.
Right.
Let's see, visceral fat levels dropping. So, that is I got tired of trying to explain visceral fat and speaking into, hypothetical, that I was like, I have to get a machine that can quickly check visceral fat, that we can check that each single digit is equivalent to 100 centimeters squared of visceral fat. You can't make that up, right? Hopefully everybody needs to, again, be bowel decompressed, poop out for accuracy, just like anything else. But all of these things matter. What do you care about the visceral fat? The inflammation that ties into the immune system that we talked about with the cytokines, and then the liver, and then the joint pain. And then we didn't even talk about type 3 diabetes, dementia.
Yeah.
Right.
Yeah.
So
Yeah.
there isn't anything that cellular health doesn't impact. There probably isn't much that our lifestyle and our nutrition and basically our food deprivation of nutrients from all the different things that we've done to the soil since we've blocked up the rivers, so the nutrients can't flow down to the riverbeds where everything is still growing. We've got so many things that are working against us, that even if somebody is just eating whole food and they're not figuring these things out, they are probably depleted and not as cellularly healthy as they should be.
Absolutely. Yep.
I'm going to be making my appointment right away.
Great.
Because you do. I mean, I'm at a time in my life where, listen, I work out every day. I eat healthier than most people I know. And I still have struggles with, and I'm going to say, visceral fat.
Yeah.
And I blame it on stress, which I feel like that can happen. But
Absolutely.
as I've gotten older, it's a struggle. And that's why Kim and I do this, because we want other people to feel good. We want to give them ways to feel good. And so bringing you on here is like, when people are at their wits' end and they have tried everything that Kim and I have talked about, this is the time for them to seek out someone who is an expert in the field of cellular health that can help them get back to where they get to be.
Yes, it is not hopeless. It does take effort. It does take intentionality. If somebody says, well, doc, I'm very busy. Pick whatever C-suite title you want. I'm just stressed all the time. The answer is, this probably isn't going to work, because you've got your vagal nerve and all of your everything neuroendocrine that's working against you, signaling stress for your cortisol levels to go up.
Yeah.
There's certain things we can't override. And that's not the point of my clinic, is not to intentionally override things. Now, it is to help boost and aid things as much as we can. For some people, like we talked about with those age-related depletions that happen, a lifelong supplementation may be something that they're going to benefit from. Just depends on how good they want to feel and to what level. But It is not, there's nothing about this, and I want to be very clear, is a miracle pill, miracle test. I do believe in miracles. Science changes, just time and space is taken out. Those happen. So I do believe in
Yeah.
miracles, but this is an intentionality of what you get your roadmap for your body and you get
Yeah.
to act on it. And that is more than, I was so frustrated for my patients in my direct primary care practice. So small practice, small patient panel that I really grew to love. And they're the ones, and I thank God for them, because I knew them well enough that something wasn't making sense. They're
Right.
doing what I was asking them to do. They weren't lying to me, and stuff wasn't changing. And they're the ones that compelled me to start digging deeper because I knew them and I trusted them and they trusted me.
Yeah.
And so, that relationship is a big deal.
I love it. I love it. Okay, I'm going to put your information in the comments so people can see it. I'm hoping to be able to get to talk to you again a little bit further. And Kim and I do appreciate you being here so much, taking time out of your day. And this
Oh,
has
sure.
been amazing.
I'm so sorry. I totally killed an entire hour.
Hey, no problem. Kim's got a flight out, so she's got to go.
I know I gotta go because we're flying out, but this is amazing. And our 7-minute health chat went a little, this is on steroids, but that's okay. It was all great information.
It's really important. It's really important.
No, I got another call I gotta go to. So
he's getting yelled at.
I know.
All right.
Thank you
Thanks
so much,
for tuning
Dr.
in,
B.
everybody.
Bye-bye.
More than welcome. Glad I got to talk with you all.
Yep, we'll see you next week.